We're here to answer their calls. We're here to help them in their time of need. And we do that by starting with the 911 call.
Fire and ambulance, what's the address of your emergency?
We start asking questions of everybody who calls.
Okay, so this screen that you're looking at right now is a very typical call, whether or not the patient has a fever or they do have a cough. On this particular patient, our communication center has identified that it is a possible coronavirus, and then that'll alert them to say what level of protection they should take.
Is anybody at home experiencing symptoms of the fever or the cough? We start interviewing the person at that social distance limitation, 6 foot away. I start looking at the patient, evaluating, is he or she coughing, is he or she sneezing, and then what level of protective equipment we want to place on the person. We would normally utilize an N95 mask, which is something that we fit test for. It's a higher level of protection than the surgical mask. We would have our people wear these, but we are limiting these to high-risk encounters. And then when we get to a call where there's a level of concern, instead of being in our street clothes, we're going to be putting on a disposable apron and wearing that so that we have an additional layer. Then these are just the dental hygienist style face shield. You know, it's got an elastic loop, goes over your face, and so they don't have that splash. So all we talk about in COVID is don't touch flat surfaces and don't touch your face. That's the general guidance to everybody in the public, right? Well, if I'm touching my face and the mask without gloves on, I've just contaminated my hands. So proper doffing is as important as having the equipment on. And that's the information that's being revised, refreshed, and sent out to everybody so that they're aware of it.
Keeping yourself safe so you can continue to do your job.
Absolutely.
Because we need to.
Mm-hmm. This is going to be a marathon. This is not a sprint right now. It's going to be a long-term issue that we're going to have to deal with, and keeping ourselves safe and healthy is going to be most important.